So welcome back. Let's talk now about who does public health in the United States. There are a lot of players. There are a lot of important organizations that have a role to play both inside government and outside government, and I just want to identify some of them for you. So first, the federal government plays a critically important role. Most of the activity in public health goes on through the U.S. Department of Health and Human Services, and in particular, there are 4 agencies I would mention. Number one, first and foremost, is the U.S. Centers for Disease Control and Prevention, CDC, based in Atlanta. They are the leading public health organization in the United States and one of the most important organizations on public health globally as well. Their impact is all over the globe. They are essential and are involved, and I invite you to go to the CDC website sometime and see the kinds of activities. The Food and Drug Administration, the FDA, is in charge of ensuring safe pharmaceuticals, our food supply, and also the safety of cosmetics. All of these happened, as you heard from Dr. Avorn, usually as a result of a crisis and a problem. So for example, why is cosmetics in the FDA? Well, it's because in the early part of the last century, there were women using cosmetic products who got significant injuries and harm because the products they used were not safe. Similarly with drugs, similarly with food. And so the approaches, again, in the activities are very much part and parcel of what we think about as public health. The Health Resources and Services Administration really monitors the healthcare workforce for the United States. And so again, that essential public health obligation of assessment is part of what they do in research planning. And then finally, the Substance Abuse and Mental Health Services Administration is very much engaged in public health activities. You heard Mary Lou Sutters talk about behavioral health is mental health and substance abuse combined. Well, at the federal level, the organization that pays attention to both of those is one entity. And so we do find, and we do actually have a Behavioral Health Services Administration, but they label it differently. Those are the key. There are many more at the federal level, but those are some of the most important. Now, every state government, all 50, and just about all of the territories, will have their own State Department of Public Health. And I invite you again, go to the website of the public health agency for your state, also your county, your local government, and see what they do. You will be amazed by the number of activities and what they do and what they're involved in. They have an organization that represents them, a national organization. For the state, it's the Association of State and Territorial Health Officers. And for county and local government, it's something called the National Association of County and City Health Officers. So ASTO and NACHO are the 2 organizations that represent public health at the national level from the state, county, and local perspectives. Outside of government, there's a lot. But some of the more important ones I'll mention here, the American Public Health Association is the professional organization for public health professionals. Their annual conference held around the country attracts as many as 15,000 to 20,000 public health people for an entire week to learn from each other. A relatively new organization, about 10 years old, called the Trust for America's Health, does important advocacy and knowledge development for the nation, focused very much on federal activities. The Institute of Medicine, we've referred to, have done landmark reports on public health in 1988, and also a 2003 report was very important. The Robert Wood Johnson Foundation, one of the largest health philanthropies, has been enormously influential in terms of helping to modernize and upgrade the public health infrastructure in the United States, as well as a host of national, state, and local foundations and philanthropies. Also, there's a very big academic presence in public health. We now have about 153 accredited schools of public health and programs. Some of them are standalone, some of them are part of medical schools and other organizations. They have an association called the Association of Schools in Public Health. And lastly, I'll just mention there's a new movement that's only about 8 years old now on public health accreditation. There's a new public health accreditation board that allows state, county, and local public health departments to go through an accreditation process to provide some accountability and some assurance that they are engaged in effective and appropriate activities on behalf of public health. So those are some of the key players. There are many more. All of these have important roles to play in terms of ensuring that public health is where it should be and that we continue to move forward.